Hello, this is a virtual microscopy slide showing a case of urothelial carcinoma, specifically non-invasive papillary urothelial carcinoma, high grade, involving the ureter. So we are looking here at two cross sections of the ureter, and as you know, the ureter is a tubular structure. So here is the wall, and this little lining here is the urothelial lining, and we have a tumor that has a papillary or finger-like or frond-like configuration projecting into the lumen. This can often cause obstruction of the ureter and therefore proximal ureteric dilatation and even hydronephrosis. Let's take a look at the second piece, and we also see this papillary frond-like architecture. You will notice that the tumor is confined to the luminal surface, and rather it is growing into the lumen, and there is no invasion outward into the wall of the ureter, and therefore this is non-invasive papillary urothelial carcinoma. Let's take a higher magnification look, and looking at these papillary structures, we can see that centrally there is this very delicate fibrovascular core with small blood vessels. And this is the neoplastic urothelium that lines these papillary structures. I will move to the second piece, which shows more classical high-grade features. And as we look at this urothelium, we can see that there is some disorganization of the nuclear arrangement. We don't have very nice polarity where the nuclei near the surface start to become much flatter. The nuclei also are definitely enlarged with vesicular or very open-looking chromatin and prominent nucleoli. As you can see, many of these nuclei contain extremely prominent nucleoli. And looking around, we can also hunt for mitotic figures. Normally, in a benign urothelium, we would expect to find mitotic figures near the basal aspect, which is near the basement membrane. And here we can see a basal mitotic figure, but in urothelial carcinoma, we can start to see mitotic figures closer to the surface, as we can see here. This is more than midway up the thickness of the urothelium. Here is another area where we can see a mitotic figure that is quite high up in the urothelium in terms of the layers quite close to the surface and definitely away from the base. So these features with the significant nuclear pleomorphism and atypia with prominent nucleoli, loss of polarity, and frequent mitotic figures, these are all features that point to high-grade papillary urothelial carcinoma. And once again, we don't see any evidence of invasion into the wall of the ureter. Let's take a quick look at an example of the gross specimen of such a case. And here is a gross virtual pathology specimen of a kidney that has been bisected with the ureter. And this is a very abnormal kidney. You can actually see that there is dilatation of the pelvic-calyceal system. And in fact, there are a few papillary tumors that are seen within the pelvic-calyceal system. And if we look at the ureter, so this is the origin of the ureter, we can see that the ureter is thickened and the lumen is markedly narrowed by this tumor within the wall of this ureter. And here is another area more distally. The ureter also appears to be a little bit dilated. And let me turn this specimen slightly. Here we can actually see right into the lumen, and this ureter has been opened longitudinally, and we can see that there are bits of papillary fronds of tumor in other areas of the more distal ureter. So this is an example of urothelial carcinoma involving the ureter at multiple areas and also the renal pelvis. Because of this obstruction, there is clearly upstream dilatation of the pelvic-calyceal system and therefore hydronephrosis. If you scroll down, you will see more information, for example, gross description, as well as some gross and microscopic images, and also some videos which explain the gross and microscopic features. For full and free access to this resource, you can click on the link in the video. Hence, in summary, this is an example of non-invasive papillary urothelial carcinoma, high grade, of the ureter. There is no evidence of invasion into the wall of the ureter, and we can see that this tumor forms papillary finger-like fronds with fibrovascular cores and lined by high-grade malignant urothelium. Thank you.